I'm William Lee Cowden, MD, and I'm going to teach you in the next few minutes some important things that you may or may not know about your dental health affecting your physical body. Very few dentists know what I'm about to tell you, and very few allopathic doctors know what I'm about to tell you. But if a person has cancer in Germany and goes to an integrative doctor in Germany, the doctor's first question is, have you been to see the biological dentist to take care of all the issues in your mouth? If the answer is no, they say, get out of here, go get that done, come back and then I can help you, because it's that important related to health. And not just cancer. We know that dental issues affect our risk for autoimmune diseases, arthritis, cardiovascular disease, and other diseases, neurological diseases as well. So you say, well, what in your mouth affects your overall health? Well, every year in the United States, there's about 1 million fillings that go into the mouth that are made from what's called silver amalgam. But it's only 20% silver and 55% mercury. And mercury is a poison. Mercury should not go into the body. Every time you chew, you release mercury from the surface of your teeth. It gets into the air that you breathe, it gets into the saliva that you swallow, and it ends up in your tissues, including your brain. In the gut, the mercury combines or is taken up by bacteria in the gut and converted into methyl mercury. So a methyl group gets added onto the mercury. Methyl mercury is extremely poisonous, 100 times more poisonous than metallic mercury, and it's very fat soluble, so it crosses the blood-brain barrier easily. Once the methyl mercury gets into the brain, there's enzymes in the brain that cleave the methyl group off, and you have metallic mercury left behind that remains there forever. We know that people that die of Alzheimer's dementia have a higher concentration of mercury in their brains than people that die at the same age without Alzheimer's dementia. So it is a contributor to Alzheimer's dementia, among other things. Now, if a person has mercury amalgams in their teeth, they need to have those removed by the right kind of dentist in the right way, in order to not become more toxic from the mercury that's released in the process of drilling those old mercury fillings out of the teeth. So the dentist needs to use a very fine burr, not a very coarse burr, and he needs to make a little crease across the amalgam and use another instrument to pluck those big chunks of mercury out and throw those in the biohazard container, and not pulverize them into liquid that is breathed, liquid that's swallowed in vapor that's breathed. So you need to use copious water irrigation, high vacuum suction, rubber dams over the teeth, and other precautions. If a dentist has never done that the right way, then the chance of them doing it the right way for you is unlikely. So you want to try to seek out what's called a biological dentist that knows how to do that the right way. And there's a variety of online sources for biological dentists. Now, the other thing that in the mouth that causes huge problems for health are what we call cavitations. And I'm not talking about cavities, I'm talking about cavitations. Cavitations are holes in the bone near the tip of the root of the tooth, or where the tooth used to be. Now, if you have a root canal tooth in your mouth, you will have a cavitation at the tip of that root, almost 100% of the time. Inside that cavitation are pathological bacteria that produce biotoxins, chemicals that poison the enzyme system of the body and the immune system of the body. And I've seen countless patients with cancers and neurological diseases and cardiovascular diseases that did nothing except take do a surgical procedure to clean out those cavitational sockets in the mouth and remove the root canal teeth, and they got well. You say, remove my root canal teeth? Well, they're dead already. So think about this. If a person has a necrotic appendix, the surgeon says we must remove the appendix before it poisons and kills the patient. If you have a necrotic or dead and dying toe, the surgeon says we must remove the toe before it poisons and kills the patient. If you have a necrotic tooth, the average dentist says, let's drill out the blood vessel, drill out the nerve, plug it with a man-made material, and call it normal. It's not logical. Okay, so if you want to learn more about this, read the book Root Canal Cover-Up by George Meinig, M-E-I-N-I-G. And you'll see research going all the way back into the early 1900s, the first of it from Weston Price and then others since then, that have proven beyond a shadow of a doubt that these are causing harmful effects. Now, the other way that you can get a cavitation is to have your wisdom teeth removed. Almost all people in this country have their wisdom teeth removed. And why is that? Because their jawbone is too small to hold all 32 teeth like it should. So as a result, the dentists say, well, those are not really all that necessary for chewing, so we'll just remove those. And in the process of doing that, they do it the wrong way. They just pull the tooth and say, okay, get out of here. And what they should do instead is they should anesthetize the tooth with a local anesthetic that has no epinephrine in it, no vasoconstrictors in it. They should then pull out the tooth. Then they should take instruments to scrape out the inner wall of that socket and clean all the infectious material out of that socket, and then use platelet-rich plasma to plug the hole so that food particles can not get down in that hole, and then give the patient some solution to irrigate the sockets with a couple times every day to make sure the food particles don't wedge their way down into that platelet-rich plasma plug that they put into the socket, and then close the gum over that so that the area will heal quickly. And if you do that, then very few of those wisdom teeth extractions result in cavitations that can cause a variety of diseases. The Chinese taught us that through the wisdom tooth socket runs the acupuncture meridians for the heart and for the small intestine, and I found that to be so true. I had a patient years ago that was admitted to the hospital with congestive heart failure and cardiac arrhythmia, and I evaluated him and figured out that he had had his wisdom teeth removed 40 years earlier, but we got his rhythm stabilized and got the congestive heart failure improved. And I said, go to the biological dentist and get him to do testing and remove the infection in those wisdom teeth sockets. So he did that, and within 2 days after he got all of that done, he no longer had arrhythmias and no longer had any congestive heart failure. Lived many more years after that. So it's a big issue. We know that in the area right behind the wisdom tooth is a energy pathway for the nervous system, the lymphatic system, the cardiovascular system. So you're at risk for strokes, Alzheimer's, dementia, MS, ALS, Parkinson's, and so on if you have infection in that area right behind the wisdom tooth. You say, well, how would I get infection in the area behind the wisdom tooth? Well, if you're laying on your back on the bed after you've had the wisdom teeth extracted and the bacteria in the socket are making acids, which they do, the acid chews away the calcium in the back wall of the socket and erodes into the area behind that called the retromolar space. The retromolar space is filled with marrow, and the marrow is a perfect growth media for whatever bugs get in there. And so a lot of people have chronic infection in the retromolar area. They did a study at the military base in Colorado Springs and found that of the military recruits that had all 4 wisdom teeth removed previously, that 100% of those recruits had at least one chronic cavitational site in their jawbone at the site of the wisdom tooth. So it's not an infrequent problem, it's a common problem. There's other things about the health in the mouth that you need to know. Making sure you don't get periodontal disease. So brush and floss your teeth, after every meal, so that the gums don't deteriorate. Because that's the other way that you can end up with cavitations and chronic infection. Just realize the importance of your dental health related to your physical health, and try to do something about that.